Sorry. Hi, good afternoon. Thank you for joining us. This is our bi-weekly career session. So we usually go through a different topic, different career every week, and we're lucky to have 3 professionals to go through dentistry with us today. So I'll turn it over to them to introduce themselves. Hussam, do you want to start?
Sure. Thank you so much, Zohaib, for setting this up and inviting me. Assalamu alaikum. My name is Hussam Din. Currently, I am a New York College of Dentistry student. I'm a current D2. Undergoing the didactic courses and the lab courses. For undergrad, I went to Queens College and I graduated in 2020. One quick fun fact about myself is that I am an oil painter, and I think that really helps me, and with the decision I made for dentistry as well.
Very nice. Sarah?
Sure. Assalamu alaikum. My name is Dr. Sarah Mir, and I'm a general dentist. I've been practicing here in Long Island in various offices for over 10 years. I graduated I'm a little older than Hussam. I graduated in 2006 from Buffalo School of Dental Medicine. I did undergrad in Binghamton, and then I did a residency in Buffalo, residency in Stony Brook. And right now I am teaching at Farmingdale State College, and I actually also work for the military. So fun fact about me, Hussam, is that actually I have a twin, and she's a dentist also. So that helped me in dental school a lot too. She helped me a lot.
MashaAllah, thank you. And Junaid? Junaid, you're on mute.
Can you guys hear me now?
Yes, now we can hear you.
Oh, great. My name is Junaid Mundia. I am an oral maxillofacial surgeon. I went to undergrad in Queens College, and I went to Temple University in Philadelphia for dental school. I did a year in Chicago for internship for oral surgery, and then I did 5 years at Brooklyn Hospital. I just graduated a month or two ago from my residency, and now I started my private practice in Stony Brook, and I'm also a teaching faculty at Brooklyn Hospital. Fun fact about myself is I've been in school for so long that this is my first job at 32.
MashaAllah, thank you. So what I wanted to do is maybe start with an overview of what is dentistry. Everybody kind of gets the idea. You have a toothache, you go to a dentist. How would you guys describe dentistry as a field? So I'll start with Hussam first.
Sure. So dentistry, I guess to put in simple terms, it's a career centered around oral health and treating diseases of the mouth and teeth. But the way my professors put it, they say it as drill, fill, and bill. That's dentistry.
Okay, Sarah, what do you got? Do you want to add to that?
I think Hussam does pretty well. It's basically taking care of the patient's oral health, which of course has an effect on the entire body too, but basically you're doctors of the mouth.
Okay, perfect. And then Junaid, do you want to add anything to that? I believe you're on mute still. Okay. So the next topic I wanted to touch upon is like, what are the different fields within dentistry? Is it all the same? If you go to dentistry school, you finish, you become a dentist. Is everybody doing the same thing? What are the types of specialties that are out there within dentistry that people should be aware of? They're like, I don't want to be the guy who just does fillings and stuff. What are the other things that I can do within dentistry? So I'll start with Sarah first.
Sure. There's so many different specialties within the field of dentistry. I love that as a dentist, we can do so many things. So a general dentist generally can do everything, but the more difficult cases you send to the specialists. For example, like just a simple example would be like a wisdom tooth removal, like a third molar removal. A general dentist can do it, but then there are some that are coming horizontally or they're impacted. In these cases, if a general dentist is comfortable doing it, they would do that, or they would just send to to Junaid Mundia, right? Who would send for to the oral surgeon. So there's oral surgery, there's ortho, which most people know about straightening the teeth. There's periodontology, which is the gingival health and health of the periodontium and all the gums, basically. Then there's endodontics, which will be a root canal specialist. There's prosthodontics, which they generally do restorative work like crowns, bridges, dentures, implants. Hossam, what are the other ones? I'm missing. Pediatrics. There's kids dentistry.
You got endo, right?
And right, we did that. What do we do? Perio.
Actually, also come up with like health promotion now too. So to advocate for the well-being of the population. So that's also an interesting new specialty they're coming up with.
Yeah.
Junaid, do you want to add anything to the different types of specialty within dentistry?
Yeah, that's dental public health. Hassam is talking about is public health. That's a specialty as well. It's dental anesthesia. And then, of course, dental radiology and oral pathology are also some specialties that if you just want to be a doctor and don't want to do any patient care, those are the specialties for you.
Okay, perfect. Thank you. So we get that there are different types of specialties within dentistry. There's the regular dentist that you might think about who goes and does your fillings. What's it like to be a dentist on a day-to-day basis for people who are like, I'm not sure if I want to go into become a doctor, a dentist, a nurse, a pharmacist. What's it like to be a dentist? So maybe we'll turn it over to Junaid. Do you want to go first?
I'm going to specifically speak about oral and maxillofacial surgery. So again, it's a surgical specialty. So the residency itself is long. It's 4 to 6 years. It's tough, whatever show you watch, like House or whatever, you see the residents working and struggling. That's what it is. You're at the hospital at 6 o'clock. You go home at 6 o'clock. You're on call. You're taking pages. You're waking up middle of the night. That's what residency is. Private practice, on the other hand, it's a 9 to 5 schedule, or it's 9 to 2 schedule, 4 days a week, 3 days a week. Whatever you want. It's how you set your own hours. But you have to pay your dues. You have to work hard and get that specialty license so you could practice. Very comfortably when you're attending.
Okay. Thanks, Junaid. I know you were cutting out.
Sarah.
So we'll turn it over to Sarah.
Like Junaid said, it's really different for each specialty that you go into. Oral surgery is very rigorous and it has very difficult hours, and it's one of the hardest specialties, in my opinion, to do. I have a lot of respect for oral surgeons. But as a general dentist, I can tell you that when I first started working, I did like what Junaid said, like the 10 to 7, 9 to 6. I like dentistry in that it's quite flexible in that you can set your own hours, especially if you have a private practice. If you work for an associate, which I did for many years, then they usually set it for you. But it's usually like I said, like a 9 to 6 job or like a 10 to 7. But I can tell you that as a woman, I knew that I wanted to be there with my children and take care of my kids. So I did find an office that would allow me to work 9 to 2, 9 to 3 to fit in the school hours. But then Also, it depends on the field, and also there's so many different types of jobs that you can find as a dentist. I feel like I've worked in so many different ones as a dentist, like to kind of fit my lifestyle. More specifically, like you can work in a private practice, but then you can also work in a nursing home where you set your own hours. You just go there, you see the patients, and then you come back. Or like you can do, then just 2 years ago, I went into academia. So that also, you can, it has a different set of hours as well. So I think it varies a lot. It varies a lot, but you can have the just 9 to 6, Monday through Friday type job.
Do you want to add anything to that?
Yeah, sure. So I guess I can say it in the perspective as a student. As a student in New York College of Dentistry, a lot of my time day to day is spent studying and doing lab work. So it would usually go like 8 a.m. I wake up, or even earlier, commute to school. 10 a.m. we have a lab. Just last week we were doing endodontics labs. So we were doing like root canals on typhodonts. These are like fake teeth. And right afterwards we'd have a lecture and attend a lecture, and right after that I'd start my studying process, which is like making summaries out of the lecture, try to retain as much information as possible. But really a lot of my time I feel like is being spent up with exam preparation and laboratory work.
Okay, perfect. No, so we get a feel for what it's like to go to dentistry school, what the hours are like, and I know it's very intensive. So I thought we would go into, so we talked a little about the field, some of the specialties that are out there, what it's like to work in the field. And you guys mentioned it varies day by day, depending on what type of field you go into and what type of negotiation or what type of facility you work for as well. Next, we did have a question that came in, so I thought we just might as well address it. So this is from Raham. The question was, considering the current times with COVID, is it difficult to see patients, or patients choose not to come in? So maybe Sarah, you can touch upon this. And Junaid, I think he cut off, but once he's back, maybe you can add on as well.
I think initially there was the fear, of COVID when it first hit, and we didn't know too much about it. So patients were uncomfortable to come. I think we were also uncomfortable too about the guidelines and proper PPE. But now I see patients are returning, and I haven't seen it. I haven't personally been affected by it too much, but I think maybe Junaid might be able to answer more.
Okay. Junaid, are you here? I know Junaid's been cutting in and out. All right, so let's keep going then. And then if we have a chance, we'll come back to this question. So the other thing I wanted to get into is, how do you become a dentist, right? So people said, all right, you guys have sold us. You really described dentistry really well. I want to get into it. What's the process to become a dentist? Do you have to go to college, graduate school? Do you have to take any exams? So maybe Hussam, you're the closest to that. Maybe you can walk us through that process.
Yeah, sure. So for dental school, there are a couple of requirements. You need a GPA requirement. There's an exam you must take called the DAT. And I can actually, after I just speak a little bit about the requirements, I'll pull up a PowerPoint that shows sort of like a ballpark range where you want to aim for your grades. There's also science requirements, which is you want to take 2 biology classes. These are the entry-level bio, so Bio 1, Bio 2. Chemistry requirements, that's Chem 1, Chem 2. Organic chemistry, both of them, Orgo 1 and Orgo 2. Both of the physics, basic English classes, calculus, microbiology, cell biology. They're actually adding that in now. It's kind of like a recent addition they're having. And biochemistry and stats. Also, you have to do volunteering and community service, approximately like 100 hours for each of them. And a committee letter is also really important. So some schools, undergrad schools, offer a committee letter to students. It's going to be really important, especially if you're looking to get into schools like Stony Brook and Buffalo that require that the committee letter. And I just want to quickly pull up that GPA and DAT score for the various schools in New York. I think it'll be really helpful for people that are interested.
Sure. And then can you also mention, can they find this somewhere on a website or something that we could share with everybody? Or, if you could point us people to where they might be able to find this type of information would be helpful as well.
Yeah, definitely. You can find it on like the ADA website. So that's the American Dental Association, and they have a lot of statistics of the various dental schools and their averages, tuition costs, all this information. They have it there.
Perfect.
Okay, let's see if I can share my screen. Okay. Are you able to see the screen?
Not yet. You click on the share button at the bottom, and then you click on which thing you want to share. It should come up.
Okay.
Now we can see it.
Okay, I think I just stopped sharing. Let me do that again. Okay, can you see it now?
Yes.
Okay, perfect. So I just wanted to give some attention to the mean score. So the DAT is exam that we take for dental school, and there are a couple of sections on the DAT. There's an academic average, which is your total score. There's a perceptual ability section, which basically tests your ability to visualize 3D models. And there's a total science, which is like the organic chemistry, biology, and chemistry section. And this exam is out of 30. There's also a section over here where it says pre-dental GPA. So that's the average GPA for all the schools. And I picked out the ones in New York and Rutgers for New Jersey. So it can kind of give you a ballpark idea of where to aim for. I'd say the average to be competitive, at least in New York, you'd want to have around a 21 DAT score. And the GPA around 3.5 would be competitive.
Perfect. That's really helpful. Thank you. So it gives you an idea for what score to aim for if you want to go to some of the schools in the New York area, what GPA you want to aim for, so you have a competitive application to dental school. And then can you touch upon how competitive is it to get into dental school? I know like medical school is very competitive, and some people are scared to take the MCAT and go that route. But how competitive would you guys say it is to get into dental school? So I'll start with Hussam first.
Yeah, I would say it is pretty competitive, and I think it's getting even more competitive because as I look at the trends from a couple of years ago, the DAT average is increasing, and same thing with the GPA average. I see a trend going upwards, so it's definitely getting more and more competitive. Yeah, it is. It's definitely getting more competitive.
Okay, Sarah, do you want to add on to that in terms of like the difficulty to get into dental school, and then maybe some tips to make your application stronger?
Sure. It's been like almost 15 years since I graduated, but I remember one thing I did want to add is that when I did apply to school, I applied in my second year of undergrad through the early assurance program, and that was a comfort knowing that like if you get in the program in second year of undergrad, that you already have your career path labeled for you. You know exactly what you're doing. You know what classes to take. And you still have to, like, I did it in Buffalo. I don't know what other schools have the program, but at the end, Buffalo still has that program. But so I applied from Binghamton for Buffalo Dental School, but it kind of just makes you like laser focused that you know exactly what you want to do. So if some students are interested, I think they should look into that as well. And just like what Hussam said, you need like the letter of recommendation, the 100 hours. I did it in a hospital, an internship, but you can do it in a private practice like that. But I think it is getting more and more competitive. People have been asking me, and they always, it's a good option. Dental school is a really good option, so people are always asking about it. But I hope that helps.
Okay. Junaid, do you want to add to that?
Yeah, there's, for example, programs in New York, such as Adelphi, has a 7-year program. I didn't know about it until I was a first year or second year in undergrad. So that's something to look into, which programs have a 7-year BS, BA, DDS program. I know my university, Temple University, had affiliations with a bunch of schools like that as well. So that's like another year that you could save. I mean, I will definitely point that out to the audience to make sure you do your research if you're in high school to see if you could get into I guess a BS DDS program. That really helps out.
Perfect. So the other thing I wanted to talk about is kind of what is the process. We talked a little bit about the process, but maybe if I could just summarize it, is it basically to become a dentist, you have to go to undergraduate, you have to go to college, right? 4 years. After those 4 years, you're going to go to graduate school, which is dental school, and that's usually 3 years. Is that accurate?
4 years.
4 years.
years.
So you guys have 4 years undergrad, 4 years dental school. And then in terms of residency, is there a residency? How long is it? And if you guys could touch upon that. So maybe Junaid, do you want to start?
Sure. The residency depends on what specialty you want to go into. Like someone like me, I did 2 years of internships trying to get into an oral surgery program, which was 4 years. Now, if you want to do an oral surgery program integrated with a medicine program, that's 6 years. But that's the longest amount of dental residency there is. Such states like New York State requires a 1-year GPR, general dental residency. Then you have other specialty programs, which varies from 2 years to 3 years. So if you want to practice in the state of New York, you will need one year of residency. But if you want to jump the border and practice in New Jersey, if you graduate dental school today and next weekend, you could practice dentistry in New Jersey.
Okay, perfect. And then what year should students who are in college, they're preparing to figure out what schools to apply for, what year should you start studying for the exam to get to dental school? And then when should you take it? And when should you do your applications for dental school? Hussam, do you want to touch upon that?
Sure. So ideally, you want to be ready for the DAT exam latest by the summer of junior year. So that's when you want to take the DAT exam, the latest. Personally, I took it during the spring semester of my junior year, just so I have time to prep up for my application in the summer, and I applied during the summer of junior year. I know people that actually took the DAT, and not just the DAT, even some students I know that took MCAT, a whole year before, so like their sophomore year, and they did well, and they didn't have to worry about it anymore. So really getting over with it as soon as possible, I think is the best bet. Especially because you want to bolster your application, the personal statement, and all those other statements take a long time to make. And getting all those letters from your professors will take time, and you want to make sure you have your application out by latest junior year summer. The whole cycle takes around a whole year, so you'll get the acceptance letter sometime around winter of your senior year. And you'll start dental school fall of the once you graduate.
Okay, thank you so much. So I think that's helpful to get people ready. So if they're in college, when do you need to start preparing? When do you do your applications? And then one thing you guys were mentioning is that there's 100 hours of community service. Is that hard to get? People who are apprehensive, like, hey, I'll never get 100 hours. It's COVID. I have a lot of schoolwork to do for college. What are some tips that you guys have? Maybe Sarah, you could share that you've seen your students or other people get as easy ways to get that 100 hours of community service in.
You're absolutely right. COVID has definitely impacted that as well, because we try to limit the number of people in the office as much as we can. So that definitely is more difficult to do, to get the 100 hours. So for the early assurance program, you could do it, the program that I did, you could do it all through, you could do it second, third, and fourth year. You just had to complete it before dental school started. So I think if it would be the same, I don't know, Hassan would know better since, you did it more recently, but like, I don't know how much, if you have to get it done before junior year, I don't know, before you apply the 100 hours, I'm not sure. But one thing I did want to mention is that when I took the DAT, I found the Kaplan course very helpful. I don't know if they still have the Kaplan course, but I found it extremely helpful and useful. I took the summer to prep for the DAT, and I thought it was very useful. So I don't know if the audience, if they're thinking about taking the DAT, they might look into the Kaplan course if it's still available.
Perfect, thank you. Sam, do you want to add upon that, like how you were able to get the hours or how you've seen your friends be able to get the hours in?
Yeah, so pre-COVID, I was able to volunteer at Hamza Masjid, actually. That's where I did a lot of my volunteering work, and it was a great experience. And as far as hospital volunteering, I did a lot of that at New York Presbyterian, Queens. And actually now, during the time of COVID, a lot of people are messaging me and saying it's really difficult for them to find places or hospitals that would accept them because of the limitations and all that. Even now, New York Presbyterian is not taking any more volunteers because of the whole COVID situation. So it is, I guess, a little, bit impactful on students that are trying to volunteer. But there are many other options. It doesn't have to be hospital. You can maybe work in private practice, or you can work or volunteer in your local dentist if he allows it. So these are other options that you can go to.
Perfect. Thank you. That's very helpful. So we talked about the career path. Of course. Sorry.
Go ahead. If you don't mind.
Go for it.
I want to add, the 100 hours is not a hard stop. This should not stop you from applying. Like that's, you don't need 100 hours to apply. That's not a hard requirement. Your scores and your GPA are the hard requirements. So focus on those and not trying to get a shadowing experience, because one way or the other, you will make it. And people in the programs, everyone understands COVID time, things are different as of right now. But, don't worry about that. If you're applying and if you're like, oh my God, I don't have 100 hours, don't let that stop you.
Perfect. Thank you. And then the other thing I wanted to start talking about is, what tips do you guys have? So I think some of the tips that we talked about is researching colleges that have a combined program so you can save a year. We talked about another program, Adelphi having a program. And then we also talked about, for the DAT exam, using courses like Kaplan, which can be a little bit expensive, but if you do your research, maybe you can get a good discount from some of these testing institutions. Are there any tips, special programs, internships that you guys wish you knew about, or you do know about and you want to share with everybody? So we'll start with maybe Junaid first.
Sure. I think the biggest thing that helped me during my DATs was the DAT Destroyer, Orgoman. All of this information, like when I was applying, I didn't know any other person that was applying to dental school. So SDN, Student Doctor Network, I definitely use that as a site to help you out. Now, don't read into it. There's a lot of people who post they have a 4.9 GPA and a 29 on their DATs, but didn't get in. There's a lot of lying on there, but there's also a lot of resources that you could extract from there. So highly recommend it, but take it with a grain of salt.
Perfect. And Sarah?
It's been so long since I had applied and graduated that I think Hussam and Junaid would be better answering this question.
Sure. Hussam?
Yeah, so for the DAT, what I found to be really, really effective, like Junaid said, Orgoman is really great. He actually teaches in Staten Island. It's like an in-person classroom, but it can be a little bit expensive if you go for the in-person classroom. It can be anywhere from $2,000 to $2,500 for the entire class. Another alternative is that Orgoman has his own book called the DAT Destroyer, which is really great. He has tons of questions from biology, organic chemistry, chemistry, perceptual ability, math, all these questions that are a little more difficult than the actual DAT, so it really preps you well. Another great resource, I think that this was my primary resource that I used, was the DAT Bootcamp. It's kind of a new resource that came out, and they basically have almost everything you need to prep from scratch. So they have videos on biology, they have videos on organic chemistry, perceptual ability, the math section, English. They basically walk your hand through the whole thing, and they have multiple exams that you can take and practice. And when I was studying from the boot camp, it was around $300. Now I think it jumped up to $500 because of the popularity that it gained. But I think that's a fantastic resource to use. Another great resource is Chad's videos on CourseSaver. He basically posts a ton of videos on biology, chemistry, organic chemistry, and questions, which I think is really important. And the last resource I used was QVault, and it's just this vault of tons of questions that really help you with the practice.
Perfect. Thank you. So the other things I wanted to touch upon were maybe for students who are in high school or college, are there any like journals that they can look into? Are there any professional societies they can join? Any networking they can do to kind of get ahead and stay up to date with what's going on in the field? So maybe I'll turn it over to Junaid first.
American Student of Dental Association, ASDA, has actually a chapter for the undergrad students. They could join it. They could attend the national meetings. They could attend local meetings. That really helps out. So these are dental students who are putting it together how to mentor the undergrad students. And then of course, ADA, American Dental Association, is another parent organization which ASDA is underneath, and then student ASDA. And then different specialties have their own specific journals, which are a little bit more scientific. So I wouldn't really highly recommend them to the undergrad or the high school professionals right now. But I would recommend that, there's some Facebook groups and there's some mentor groups that you could join that really do help out. And it's a community, so people are there to help out each other.
Perfect. Thank you. That's very helpful. Sarah, Hussam, do you want to add to that?
Yeah, so for me personally, in Queens College, they had a pre-health group, and I know a lot of people that did join that and found it really helpful. Personally, I did not join any pre-dental or pre-health group, but what I were really out there to help and mentor. And I think, creating those close connections from the MSA really helped me, with the coursework at Queens College.
Perfect. And Sarah, you're a professor. What are your tips, or is there any advice?
I just wanted to tell the audience just to keep in touch with their pre-health advisor, like constantly. I would go all the time, and I remember the students who keep coming to me. Remember, okay, let me get their letter of recommendations out. Let me get their things out. So like. I remember even I just went right away. In the first week, I'd like to meet, Dr. Langhorn. I want to meet the pre-health advisor. And then I would go every few months. Oh, do I have the correct courses? I just wanted him to see me, know my face. After, okay, a few months later, another appointment, please. Just make up some excuse to go in there. So that by the time he had to write my letter, he knew me. He said, okay, Sada's going to keep banging on my door. Let me, she's really serious about going to dental school. You know what I mean? So just constantly stay in touch with your advisor, or if you don't have one, go seek one out, and find one for yourself so that you can make a relationship with them, have a relationship with them.
Perfect. Thank you. So we talked a little bit about tips of getting ahead in your application process. We talked about the career. We talked about how to become a dentist, all the educational steps, exams you have to take. So now let's get to the numbers. People want to know, what is the starting pay? What is the average pay like within the dental field? Maybe with Junaid first.
Sure. Of course, if you're a specialist, your pay increases. Doesn't matter what specialty you are. I have friends that could start from 125 to specialist fee salary of 500. Now that also depends on where you go and where you work. You want to work in an urban area like New York City, you're not gonna make as much. But if you want to go move to Wyoming, middle of nowhere, you are gonna make a lot more. Supply and demand makes a big impact in our field.
Okay, perfect. Sarah, do you want to add anything to that?
I agree with what Junaid said, and also it like in Long Island, there's plenty of dentists. Every other office is a dental office, so you'll make more if you go, out west. But I think in Long Island, I was discussing with my friends too about the average would be 150 to like 150 for a general dentist. Also, but it depends on what kind of office you work in, your hours, whether you're full-time, part-time. It really depends on which field you're going to. I mean, and which office that you are in. So I think it varies a lot.
And then for people thinking, well, I'm going to go to 4 years of college and 4 years of dental school, and I'm not making any money during this whole time. All my friends are graduating, making money. Do you get paid during residency? I know you mentioned New York State's a 1 year requirement for dentistry. is there pay? Do you get paid during that time? Can one of you guys touch upon that and what the pay is like during that time?
Since I've been a resident for the last 6 years, I'll go answer that. Yes, you do get paid. It's a PGY salary. It's whatever the medical residents get paid. Each hospital is different. If you go to LIJ, I think they pay the most compared to my hospital. They didn't pay that much. But regardless of anything, all of that stuff is listed online. You could actually figure out what they pay. But when you're specializing or when you're joining a GPR, the goal is not the money. The goal is the training. So and being accepted. So whatever program you get accepted to or you apply to, it's for training and acceptance. And then the money is good. It's about 70, 80, 85 by the time you guys are applying and in that position. But it's basically to pay your bills. There's no savings going on at that time.
Okay, perfect. So I think so we talked a little bit about average pay, and then you guys mentioned it'll vary depending on where you work, out of state, in New York State. It also varied if you're specializing, and then if you're working part-time versus full-time. And then I'm sure the hours we touched upon that a little bit earlier, what the hours are like, and it varies by specialty, whether you're residency, whether you're in dental school, etc. Maybe you guys can touch upon what are some of the positives of going into dentistry, what are some of the negatives of going into dentistry, just so people get an idea of dentistry compared to other fields within health. So maybe I'll turn it over to Hassam first. You decided to go into dentistry. Maybe you can tell us what's some of the pros and cons you balanced were.
Some of the pros that I feel are in the dental field is that it has a lot of flexibility, especially once you get your own private practice. You get autonomy. It's a great salary. Some of the cons I would say is that for schooling, it is a lot of money, a lot of tuition that goes into schooling. It is many years of schooling. It's almost the same as a doctor, except the residency is kind of cut if you're doing general dentistry. And one thing I never knew before going into dentistry was sort of like how much of a toll it takes on your spine, because you have to keep your neck at a certain position and all that. So it does take a little bit of a toll there too. But now they have technologies like loupes. They call them loupes, which are I guess magnifying glasses that help correct your posture so you're not facing any of those difficulties.
And that gets to a question we had from the audience. Somebody asked, how much does it cost for the entire program? So I'm assuming this means like for dental school, essentially for the 4 years. What is the average tuition like in the New York area? Can you guys give us some figures of some of the top schools or some of the better well-known schools? And what's the average cost that people are looking at if they want to go to dental school? Hassam, do you want to start first?
Yeah, sure. So the average cost for dental school right now is anywhere from 80K to even 110K per year. So it is quite expensive. The prices have been going up and up and up in the past couple of years. And one thing that kind of deceives a lot of people when they look at the prices for dental school is that they look at tuition, but really you have to look at the cost of attendance, which includes instrument fees and all these other fees. And it adds up to a lot. For example, like Stony Brook is like 80K. Buffalo now is like almost 80K. NYU is almost like 100K. And there's many other schools are in that same range per year.
Okay, perfect. And then, so while we're on this topic, how do most people pay for dental school? Can you guys touch upon that? I'm assuming it's probably most graduate programs, you don't really get a lot of financial aid, but my understanding is there are grants that are available and other types of ways of getting low cost loans that allow you to pay it back without a lot of interest accumulating. Can you guys touch upon how to pay for dental school for those people who might not be from super wealthy families? How does the average person handle that cost for dental school? So maybe Hassan's been going, maybe Junaid, do you want to touch upon that?
Sure. There are multiple ways, and I found out about it, some of it, when I was in dental school. First, it's typical student loans, right? Of course, it has your interest, but the interest is high, the tuition is high because they know you're going to make the money and be able to pay back. Second, if you own a home, if your parents own a home and they don't want to take out a loan, you can always do home equity loan. Interest is a little bit lower, so that helps out compared to a regular government student loan. There's another organization called a continuous charity. They don't have a chapter in New York yet, but they do have it in Pennsylvania, which is a Muslim organization that gives you a loan that you promise to pay back. It's an interest-free loan. So that's something that you could definitely look into. And of course, one of my friends in med school actually went around to a lot of people asking for money, asking for not donation, but a loan, an interest-free loan. So he went to thousands of people asking for $100 each that he's going to pay back. And he actually had a contract with everyone. And he did 4 years of med school without any interest. And that's the way he pursued it.
Inshallah. Do you guys want to add on to that, Hussam or Sarah?
Yeah, so another option that I've heard from people, there's a couple people in my class that are doing this, is that they join the military. And what the military does is that they pay for all 4 years of your dental school. They also give you $2,000 a month for just your own place, food, whatever it is. And after that, you have to work in the military for 4 years, and they can put you in anywhere. And I think they give you like $50,000 per year for those 4 years after dental school. And you do also get the benefits of being in the military. So that's another option to avoid interest.
And just to clarify, when you're in the military, you're working as a dentist in the military?
Yeah, as a dentist. Yeah.
Perfect. I know for medical school, there is a process where if you work in like low income areas or poverty stricken areas for X amount of years after you graduate from medical school, they'll pay off all your medical school loans. Is there anything similar to that for dental school?
Oh yeah, there actually is. There is like some programs that say, okay, after dental school is finished, if you work at Wyoming or Ohio, these sort of places where there's a fewer concentration of dentists, then they will pay off your student loans or give you a higher salary.
Okay, perfect, mashallah. So those are all good options for people who are worried about the cost of dental school, of ways to approach it and make it a little bit more reasonable to pay off. So then we talked about starting pay, we talked about hours, we talked about some of the pros and cons of the field. And then can you touch upon if the field is increasing, declining, stable? What is dentistry like? Isn't there an excess of dentists? Are there not enough dentists? What's the field like? What can people expect after they graduate? So maybe Junaid, you can start first on this one, and then Sarah, you can go next. Okay, looks like Junaid might be having technical difficulties. Sarah, do you want to start first?
Sure. I can tell you that as a dentist who's been here in Long Island for so many years, that there's always somebody looking for a dentist. There's always a job opportunity. At least from my experience, I've always seen that there's always a job opportunity. Of course, like we're in New York City, and near New York City, there's always someplace. I mean, if you go out west, there's a much bigger need for dentists than over here. But in my experience, there's always been like a job posting or a job opportunity somewhere.
Perfect. Assam, do you want to add on to that, what you're seeing from like the numbers growth wise?
No, I'm just as interested to know the answer as well.
Okay.
So it's good to know that there's still a high demand out there.
Perfect. I think we lost Junaid, but hopefully we'll get him back soon. So the next thing I want to touch on is like minority Muslim issues. Is there anything unique or special about dentistry that makes it easier to be a Muslim to work in dentistry that you guys have found from your experience? Maybe sometimes for like women, there's certain benefits to certain fields, or people who are parents, both men and women, once they get kids. So maybe Sarah, do you want to start on that topic?
Yeah, sure. And actually, that's what I love about dentistry. I found it to be very flexible. Like I've been able to have 3 kids along my journey, you know, and alhamdulillah, whether like after each child was born, then I would work 1 day a week and slowly increase to 2 days and 3 days. And then now I'm back to full time. But I felt, and as a woman in hijab, I never, thank God, alhamdulillah, I never had that problem, or I never felt that sort of like racism or I've always felt a lot of respect. And I think this is why there are a lot of Muslim hijabi dentists I found along the way. Like I've always felt a lot of respect. And initially when I first started interviewing for jobs around here, I wasn't sure how I would be perceived. And so one would say I remember one guy ended up working for 6 years. He said to me, what's all this going on? So I just made a joke out of it and said, infection control, sir, infection control. And he was like laughing. And then he's like, okay. And then, you know, we were fine. Like I ended up working for 6 years, you know, I think it's a very good field. I think for a man and a woman, but I can tell you as a woman in the field, I think it's excellent. Like there's just so much opportunity and flexibility in this field. And even, I know I have to leave soon, but there was one question I remember you had asked about prayer times and salah times. And alhamdulillah, there's always been, you know, there's such large gaps that we have for our salah that we can, in this field, we can say, sorry, 1 minute and just ask the patient to wait 5 minutes, or don't even, you know, tell them. Like I didn't find that I would even have to let my colleagues know that, oh, I'm going to pray. I just need a break for 5 minutes. And then I would just go outside, whether it's outside the office or in the hallway, or even Hussam, through dental school, I'm sure you have the same thing. You just go in another lecture hall quickly and pray and return to the class. You know, alhamdulillah, I found that in this field, we don't have such long, at least as a general dentist, we don't have such long procedures that we have to miss our salah. And that's one thing I really like about dentistry too. Alhamdulillah, we're able to fit our, you know, all the things, our requirements of our deen as well in our profession. Alhamdulillah.
Perfect. Thank you so much, Sarah. I know you have to go, so we'll continue with Hussam and Junaid, and hopefully Junaid will be back shortly. So,
Okay.
Hussam, we'll turn over to you.
Yeah, so what I noticed, particularly in dental school, is that professors are really, really accommodating to religious observations. Like if I have to go pray, I tell my professor, hey, professor, I got to leave lab. Or sometimes I don't even have to tell them, and they let me pray whenever I need to. They understand, especially during the month of Ramadan, they give us accommodations to have practicals shifted from sunset to like midday, so that we can do the practical, go back home and break fast instead of breaking fast in the middle of a practical. A couple of professors even they email you with Eid Mubarak whenever Eid comes. So it's really heartwarming to see that, you know, the faculty is supportive.
Perfect. Thank you. Junaid, do you want to add to that? I know we lost you for a few minutes, but about being a Muslim, a minority working in the field of dentistry, are there any benefits, pros, cons that people should be aware of? I think we lost Junaid again. All right. So the other thing I wanted to touch upon are there any unique benefits? Junaid, are you back?
Can you hear me?
Yes, we can hear you now. Sorry. So we were touching upon like pros and cons and being a Muslim or a minority in this field.
No, I
think we're losing you. Okay. So we're going to keep going, and then hopefully Junaid can come back in a few minutes and we'll continue. In terms of, okay, is there anything you wish you knew about dentistry before you got into the field? So you've been in dental school now. Is there anything you wish you kind of knew going into dentistry that would have made the process easier for you, Hussam?
Yeah, so I guess one thing that I wish I knew, I think I touched upon this already, is something we call ergonomics, which is the position of your posture in dentals. Whenever you're doing like a dental procedure, it has to be really good so that you don't have long-term injury with your neck or anything. A lot of dentists, you may find, you know, old school dentists, they're kind of hunched over like this because they don't practice ergonomics. And using devices like loops, which kind of help you see better and making your posture better really helps with ergonomics, and just maintaining, having good mindset on what you're doing and making sure your posture is always good is always helpful to avoid like back pain, neck pain during long procedures.
Perfect. Thank you. Junaid, do you want to continue? We're talking about like pros and cons of being a dentist, and then Muslim and minority issues of being in the dental field. Okay, I think we probably still have a bad connection then. All right. So we have about a few minutes left, and I wanted to touch upon what are some things that you think are beneficial for people to be good at, or skills, ability, personality traits that you found that make a good dentist. So Sam, do you want to share anything about that?
Yeah, so one really helpful skill, if you kind of have, it would really help you in dental school, is having good manual dexterity. So, for example, if you're good at art, or if you're good at like wood crafting, or you're good at like even drilling, those skills actually roll over to dental school. And I didn't realize how much it would be helpful, but a lot of people that are good in these manual dexterity crafts are really good in the laboratory work in dental school. Another thing that you want to maybe look for is being really someone that's truthful, because a lot of times dentists are perceived as people that they're just there to take your money. And my dentist always told me that the number one thing that he tries to implement is being truthful to his patient, just so that there's clear communication and trust. And I think that's really important for a dentist to have with his patient. And one last thing is having a lot of discipline, especially during dental school. I think it's really, really required to have discipline and constantly pushing yourself in order to be on top in dental school.
Perfect. Thank you. So I think we did get a question in from the audience. So it was from Salman. It was related to what are some everyday tips to keep our teeth, gums, tongue healthy for the long run? So I thought that was a fun question. So do you want to touch upon that? What are some tips that you've picked up on being in dental school that your professors have shared with you, have you read up on, that all of us can implement? I know someone earlier had mentioned using the miswalk. Do you want to add to that?
Yeah, sure. Assalamu alaikum, Salman. How are you? So what we learned in dental school was basically to keep good oral hygiene, and ways you can do that is by using fluoridated toothpaste. So fluoride is actually like the main ingredient you want to be looking for in your toothpaste. And usually they have it in 1,000 to 1,500 parts per million. And what it does is basically strengthens your tooth by, I don't want to get into too much of the science, but essentially the bacteria that infects your tooth for these cavities, they release acid that sort of break down your tooth. Fluoride strengthens your tooth so that the acid is no longer going to break down your tooth. And that's the power behind, fluoridated toothpaste, even fluoridated water we have in New York City, where there's water's fluoridated at 0.7 parts per million. Fluoridated mouth rinses. These are also great options to utilize to help keep your mouth protected. And of course, flossing to take out any decay or bacteria that's stuck between your teeth is important.
Perfect. And then we did want to mention to everybody, I know we all have a few minutes left, but we are asking everybody, we put a survey together and we want to put this out there. So in the survey, we basically want to ask all of you guys who join us, if you could please take a few minutes. The link is up on the display. If you could fill out the survey, kind of gives us some feedback around how we're running this program, how we can make it better, what are some fields that you guys, topics, careers you guys want us to touch upon in the future, and then get your feedback. And then that way we can implement it and make this program even better. So we have a few minutes left. I know Sarah had to go, and Junaid, we lost him. So we just wanted to take a few minutes we have 5 minutes left. If anybody has any questions they've been holding off on, this is the best time to ask those questions, get them out there. I know people have been asking some questions about dental hygiene, the cost of dental school. We've been able to touch upon all those questions, but if you have anything else on your mind, feel free to ask. This is the best time to ask. Otherwise, we did want to share some general tips for everybody in any career. I would say the first tip is generally seeking out mentors. So right now, if you're interested in dentistry, we had 3 professionals up today in the field. So if you're interested in reaching out to them, asking them questions directly, maybe you were too shy to ask the question, we have our email address, muslimyouthmentors@gmail.com. You can email us. If you have a question for Hassam, we can reach out to Hassam and connect you directly with him, and then you can ask him your questions directly. So please don't be shy about reaching out. If you're looking for a mentor, or even if you're a professional and you want to be a mentor yourself, reach out to us and we can help work with you to connect you with students who need mentors. So that's the first thing I wanted to mention. The second thing I wanted to mention, as Hassam touched upon earlier, was having a good GPA. So no matter what field you want to go into, it doesn't hurt having a good GPA, just opens more doors for you. The lower your GPA, it closes certain doors for you. And if you're struggling with your GPA, there's always resources like the tutoring center you can reach out to, other people within your class to reach out to. And if you're not sure about your career, many career centers at your school will have a career survey you can complete, usually free, online through their career website. And that will tell you, based on your skill sets, based on your interests, what careers might be right for you. So if you're trying to say, hey, thanks for talking about dentistry, I'm not sure if it's for me, consider taking one of these career surveys and seeing how you do, and it will guide you in terms of which careers might be right for you. If you also visit our website, muslimyouthmentor.com, we also have a career survey up there in the resources section that you can complete as well. So those are some things I just wanted to make sure I mentioned at the end for anybody interested in seeking out career advice in general. So we have 3 minutes left. I'll turn it over to you, Hassam. You're our current expert. Do you have anything else you want us to know about dentistry, or us maybe tips in general that we can all implement to take better care of our teeth and avoid seeing you in the future?
Yeah, no, dentistry is a great field, for all those that are interested. It is a fantastic field to get into. Autonomy is one of the great aspects of dentistry. Good salary, you can choose hours, once you get to a certain point in dentistry. And I think it's a great field to invest in and to get into. And for tips, I guess, to keep, your oral health in check, again, make sure fluoridated toothpaste. You want to look for that fluoride at the back of your toothpaste. And a lot of people, when they complain about sensitive teeth, I have sensitive teeth, they often go to Sensodyne, which is, it's helpful for sensitive teeth, but actually an even better product that you might want to go, utilize is amorphous calcium phosphate containing toothpaste. So amorphous calcium phosphate will block all that sensitivity that's happening in your teeth. And it's something to look into if you're, having any of these sort of pains. And, just the other day I had questions about people asking me, what's the best, teeth whitening strips? They're looking for teeth whitening strips. And they've used these toothpastes and, they brushed their teeth and they didn't find it to be helpful at all, these teeth whitening toothpastes. So another option would be to go to the dentist and get it actually bleached. So that's one option you can have for teeth whitening. If you don't want to go through that whole process, you can actually buy teeth whitening strips from Crest. So Crest has these really good strips that you can put on, and after around 2 to 3 weeks, you'll see results.
Perfect. Thank you so much for all your time. Thank you, everybody, for joining us today. And then we'll be touching back in 2 weeks and we'll announce what the topic is going to be. And as a final reminder, please do take a second to click on that forum link that we've sent out. Give us your feedback, how we can make this program better and implement other programs as well. And then one other final reminder is on August 28th around Zohar time, we will be having a live event. It's going to be a LinkedIn event where we're going to talk about tips to improve your LinkedIn profile, get better at networking. And we'll have a professional photographer there who's going to take professional photos for everybody. And then those will be shared with you so you can update your LinkedIn profile with a professional picture. When you apply for jobs, you can use that professional photograph as well. And for any other purposes, you can use that as well. And that will be all free of charge. So we are working on planning that out. Look out for a poster coming out about that event. And it will all be in combination with Masjid Hamza. So that will be Saturday, August 28th. And we just wanted to give everybody a heads up that that event is coming up soon. So thank you, Hussam, and thank you, everybody, for joining us. Jazakallah khair and assalamu alaikum.
Thank you for setting this up, Zohaib. It was a great event.
Of course, thank you.